Being a woman is amazing, but it does mean we have to put up with quite a few extra health problems that don't affect men quite as much. And one of those is urinary tract infections, or UTIs, or you might know it as cystitis. And the reasons we tend to get this more than men is our anatomy is different. So we have a shorter urethra. That is the tube that carries the wee from the bladder out. And because it's shorter, it means any bacteria from the poo, the back passage, can more easily make their way up there. So what symptoms are there? Well, you probably know quite well, you often get kind of burning and stinging when you're passing urine, don't you? Really irritating. You may find that you're up in the night passing wee, makes you tired and feel rubbish, and also your wee looks more cloudy. So they are the three main symptoms we notice for urinary tract infections. But you might also find that you're just going more often. You might find that you've got an urgency to pass urine. You're like, you've got to go now, otherwise you're not going to make it. You might have some lower tummy pain, and you might even see blood in your urine. So if you've got two or more of those main symptoms and you've got no new vaginal discharge, then it's highly likely you have got a urine infection. If you haven't got two or more of those main symptoms, you've just got some of the other symptoms, then maybe there's something else going on. That could be it's kind of postmenopausal changes, it could be irritation from sex, inflammation, or it could be sexually transmitted infection. So what should you do about it? Well, if you are an adult woman, not pregnant, and you're not feeling too bad, then usually your symptoms will clear up within 2 days. So I would suggest you drink plenty of fluids. Avoid too much caffeine and alcohol, which can make it worse. There isn't great evidence for cranberry juice or cystitis sachets that you can buy, but feel free to try them. And obviously some simple pain relief such as paracetamol or ibuprofen. Those things can help. But if you're not better after 2 days, or you're pregnant, then you probably need to go and get a GP appointment or see your healthcare provider. But if you are feeling really rotten, perhaps with a high temperature, maybe you're vomiting, maybe you've got pain in your kidney, you might be shivering or confused, then please do get seen straight away. So if you do go and see your healthcare provider, you may be given a short course of antibiotics, which usually helps sort the problem out. But for some women, they get recurrent urinary tract infections. And as a GP, I see a lot of these women, and it's really awful. It really actually has a massive impact on their life. This could be you. So what can you do about it? Well, there are a lot of simple changes you can try and make to help reduce this. Simple things like just making sure you're wiping front to back when you're going to the toilet. If you're sexually active, have a wee and a wash before and after sex without any soap. Try not to hold in your wee. But also don't rush it, so make sure you do empty your bladder properly. Some people like to try an over-the-counter supplement that has some evidence for it called D-mannose, so you might have to look into that and try it if it's suitable for you. If you are postmenopausal, so if your periods have already ended, then you might want to try a vaginal estrogen. Now, I recommend this to so many patients. I find a lot of women are coming in, they've got recurrent urine infections and they haven't thought about, or no one suggested to them, vaginal estrogen. Because we know that after you've gone through the menopause, then you're much higher risk of getting recurrent urinary infections because of the changes that go on within the vaginal flora. They might also have vaginal dryness, pain on sex, and actually vaginal estrogen can be really fantastic to prevent those things happening. And you probably need to be on it for life. So if that's you, definitely consider that. But for some women, they do need to be on preventative medication. So often that's a daily antibiotic, just a small dose. So which isn't ideal, but if that's what you have to do, then that's what you have to do. So there's lots of things you can do about urine infections, but remember, for the vast majority of cases, your body is very good and can help sort it out by itself. Hope you found that helpful. I'm Dr. Sophie GP. Do subscribe, comment, let me know what you think, and I'll see you in my next video.